Everyone. Welcome everyone to our webinar today. We're going to give a few minutes for people to join. So just if you can hold tight, we'll leave a few minutes for that. We'll be with you very soon and welcome. Thank you. While we're waiting, please do introduce yourselves in the chat box. If you can let us know your name, the organization you're coming from, and where you are located in the world, that would be wonderful. And we'll be with you soon. Okay, Sanya, can we go to the next slide, please? And I think we're going to go ahead and get started because we have a tight schedule today, and I want to respect the fact that those of you are already here. So welcome to today's webinar. This webinar is our first webinar, Nutrition as Early Childhood Development. How can nutrition in emergencies programs optimize young child development? We're very excited to be coming to you today with this first webinar of the Nutrition and Early Childhood Development in Emergencies Working Group of the GNC. We hope you'll enjoy it. Can you please go actually to the next slide? Sorry, I'm going to ask you to go backwards first to the interpretation. I want to make sure everybody knows how to get into the interpretation. Okay, if you haven't used interpretation before, we do have the ability to listen in various languages. So translation is available into English. So English is the main language, although we will have one of our panelists that will be speaking in Spanish. You can listen in French, Spanish, and Arabic or English. If you go to the bottom control bar, you'll see the little globe that says interpretation. If you click on there, you can listen in English. You choose the channel that you would like to listen into. If you have any trouble, please just type something into the chat box. And otherwise, we will be using the Q&A. You'll see Q&A on that bottom bar as well, where you can ask your questions that you want to pose during the Q&A session. And if you are going to be listening in one of the other languages or in English, we will have one person that will be speaking in Spanish. So you'll need to make sure to use that interpretation feature at the right moment. Okay, we can start, please. Wonderful. So first, this webinar is brought to you by the Nutrition and Early Childhood Development and Emergencies Working Group. It's a very small group for the moment. It was only launched in December. This is our first event of what we hope will be a series. We're hoping to have at least 4 this year, but fingers crossed that goes well. And you can see the organizations that we're all coming from. And can you click the next one? We also want to say thanks to our donors who make it possible for us to be able to provide technical support and also to be able to bring these webinars to you. So our donors are there. So USAID, Irish Aid, UNICEF, and Global Affairs Canada. I hope we have people from those, from each of our donors on the call today, because I hope they get to take advantage of this space as well. Next slide, please. Okay. The objectives of the webinar today, first is is to orient participants on early childhood development in nutrition, presenting the evidence, the perspectives from implementers around the world. This will be done by Maureen Black, who I'm going to be introducing in just a minute. We are hoping it's also going to be a moment to, this is going to nurture interest in child development beyond nutrition. We want to begin to cultivate spaces for discussion and sharing related to child's development and nutrition and emergencies. We know there's a lot of interest between early childhood development actors and nutrition actors, and we want to really cultivate spaces for us to join together to be able to see how we can actually improve our programming to optimize child development. Next slide, please. So the agenda today, we have the introduction, which I'm doing right now. We have a presentation of the evidence from Maureen Black, who, as I said, I'm going to be introducing in just a second. We will have views from several regions. So this is going to be a panel discussion that Eduardo is going to facilitate. We will have a very short question and answer session. I want you to take this as a short opening webinar to whet your appetite. We will not have a big space for Q&A. We wanted to keep it short to an hour so more people could join. But do share your questions. If we're not able to get to them, we will continue the discussion later. And we will make sure to see how we can contact everyone and get back to you. And then we'll have a very brief closing. On to the next slide, please. Okay, I'm going to have to keep this super short as we don't want to get behind before we even start. So for today's facilitators and presenters, I'm going to introduce our guests before I introduce the people from our working group. We have Maureen Black, who is a PhD. She's a professor in the Department of Pediatrics at the University of Maryland School of Medicine. She's also a distinguished fellow at RTI International and an adjunct professor in the Center for Human Nutrition at the Johns Hopkins Bloomberg School of Public Health. I'm going to leave it there for the moment because I do need to go quickly to others. So Maureen, we'll be hearing more from Maureen in just a few minutes. And I want to make sure there's time for her. So thank you. Then we have Miss Rosemary Mwaisaka. She has broad experience in public health, nutrition and development policies, high-level advocacy, capacity building, program planning, management, monitoring and evaluation. With more than 17 years of experience in the field of public health, nutrition, and development, working with the UN and other international organizations. She's worked quite a long time with the East Central and Southern Africa health community to provide leadership in establishing regional policies, strategies, and guidelines, and support capacity development, knowledge generation, and dissemination and advocacy efforts on NCDs, food security, and nutrition. She is with us. She has pioneered the ECD agenda in this region by facilitating adoption of the global nurturing care framework in 9 of the ECSA HC member states through the establishment of Responsive Caregiving Experts Committee, and worked with the African Union Commission and the West Africa Health Organization to advance holistic child development agenda in the African continent. So she's coming to us today from the African Early Childhood Network. So we welcome Rosemary. And then so she is our first panelist. Our second panelist is Hannah Rabadi, and she is coming to us today. She's a nutrition and public health expert, currently working she's working with World Vision. She leads the evidence learning and accountability team, whose primary role is to ensure consistent evidence building and high quality monitoring and evaluation processes at World Vision, Jerusalem, the West Bank and Gaza office. Welcome, Hannah. We're happy to have you with us today. I have no doubt lots of people are looking forward to hear your perspectives from what you're experiencing at the moment. Okay, and our next panelist is Luisa Vargas, and she is with us, coming from Colombia, and she is the current senior technical expert in health and nutrition at Save the Children Colombia, with more than 12 years of experience in key areas such as development, research, critical care in pediatrics, and university teaching. She holds a master's in child development, further enhancing her experience and expertise in the field. Welcome, Luisa. We're very happy to have you with us as well. She's coming to us from Save the Children Colombia. And very briefly, I'm going to go through the members of our panel who are with us today. In fact, we're hoping it's not going to be Colleen, and it's actually going to be Adunya, who works for Action Against Hunger USA, who will be supporting us in our Q&A. He is I unfortunately don't have his title right now. So Adunya, maybe you can pop on your video. But he is currently in Tanzania at the moment. If he is unable to connect because of the problems in the East Africa region at the moment, then Colleen will jump in, and she is the technical advisor, senior technical advisor with World Vision International for the Q&A. Eduardo Garcia Roland, he's the early childhood development specialist with UNICEF. He will be supporting in moderating the panel today. And I am Andy Kendall, the GNC operations team coordinator for Nutrition and Emergencies Technical Services, and I'm hosted by Action Against Hunger Canada. And with that, I've gone over my time, so I'm going to quickly roll over to our first presenter, who's going to tell us about the evidence, and this is Maureen Black. Over to you, Maureen. Thank you.
Thank you very much, Andy, and welcome to all of you who have joined this webinar. I'm delighted to be here. I'm Maureen Black at RTI International, specifically at the Center for Thriving Children in RTI, and also from the University of Maryland School of Medicine. Next. And then next. Okay, we're going to talk about the commonalities between nutrition and early development. You can see we're looking at ages conception through 8 years. So the first 1,000 days goes from conception to age 24 months. That's 9 months of during the prenatal time, and then 24 months to age 2. Together, that's 33 months. And if you multiply that by 30, you have 1,000. And then the second 1,000 days is the preschool period. So you can see the children experience extremely rapid growth during that time. Next. They also experience extremely rapid development during that time. So there are many, many things going on very, very early in life. Next. This is a picture of early brain development. I've drawn a box around the first 1,000 days. You can see that it begins at conception, goes through birth, and then goes by months up to age 1 and then age 2. Look at what we have going on in our brains at that time. So the auditory and visual cortex are coming online. There's synaptogenesis. It's a phenomenal amount that's happening. Now go up in the chart on the right and find your age and what's going on in our brains right now. Not that much. Next. This shows us just an example of the nutrients that are needed during that time. During the first 6 months, children get iron from their mother's stores, assuming their mother had stores. But during the second 6 months, and I've drawn a box around that, the need for iron is high and the mother's stores are gone at that point. So this is a very, very critical period. This is also the period of complementary feeding. So you can see that that nutrition and brain development have many, many commonalities. Next. What this shows is a life course perspective. What we wish for all children, regardless of where they are, starting from conception, is that they have healthy nutrition and learning opportunities that extend to birth, early childhood, adolescence, and then adulthood and into the next generation. Next. So this is an optimal trajectory, and it begins by achieving one's developmental potential. Next. Too many children don't make it on that trajectory. And you can see if you go off the trajectory early in life, one is at increased likelihood for chronic health problems, limited economic potential, and into the next generation represented by a child who is stunted. Next. So these disparities increase over time, and what we try to do is eliminate them or reduce them as early as possible. Next. So when we think about some of the parallels between nutrition and child development, you can see that they begin prior to conception with healthy nutrition for mothers. An example, of course, is the need for folate. And that's the closure of the neural tube takes place 22 days post-conception. Women don't even know they're pregnant at that point. So the nutrition of adolescents and women of childbearing age is absolutely critical to the children's subsequent development and growth. From birth to 6 months, of course, this is the breastfeeding exclusivity period. And for infants, what they're able to do in terms of feeding is suck and swallow. They're not able early on in order to move food around their mouth and swallow. Then 6 months comes. That's such a critical time. That's where complementary feeding and early finger feeding comes in. We can start to increase infants' diet and meal frequency. And for infants, for their development, they have oral motor skills. Now they can move food around their mouth and swallow. They can sit independently, and they begin to have some hand function. Next. And then 12 to 24 months, when they're age 1, the dietary complexity increases as they're then introduced to the family diet and to some utensils or however one is eating in that culture and starting to drink from cups. And a toddler, in their development, they're interested in imitating family practices, self-feeding and drinking, and they can tell you what they like and what they don't like in a way that you can understand. And then 23 to 36 months, this is when children are age 2. Well, they're exclusively at the family diet, and it's a huge temptation for negative habits, such as using food to manage behavior, allowing children to decide what to eat. If they decide, it's often heavy sugar or things that are not healthy, but they're self-feeding and drinking. And children in their development, they can clearly express their likes and dislikes. This is also a time of neophobia, where children are hesitant to try new things. So it's food refusal. So you can see how fast development happens at this period in terms of nutrition, in terms of feeding skills, and just in terms of language and other areas of development. Next. I'm going to talk a bit about nurturing care, which Andy mentioned in her introductions. So nurturing care, this is what every child's brain expects and needs. Next. Health. Next, nutrition. Next, responsive caregiving. Next, opportunities for learning. And next, security and safety. Okay, next. This is a systems model. So each component is necessary. No single component is sufficient. If you only focus on nutrition, then you miss the other areas. If you only focus on early learning or development, you miss the other areas. If one area is not working, the whole system can be awry. Next. Next. So this is how the child gets what they need. They get it from the environment. They get it from us. And it starts with their family and then extends to communities and then to services and ultimately to policies. So what we need are family and child-friendly policies to make this system work. Next. I'm just going to focus a bit on responsive feeding, part of responsive caregiving, because it's not well understood. So this is just an example of what it means. So for example, a child whines and a caregiver offers veggies. And then the baby opens the mouth and the caregiver feeds a bite. Uh-oh, now the baby fusses. Next. This is what fussing might look like. And then the caregiver smiles and offers finger food. So changes directions a little bit, but very responsive. And then next, the baby smiles. Next. And eats the veggies. So responsive caregiving is being tuned into your child and being able to read your child's emotions and to react, to make a change that's consistent with where you're going. So it's a lovely concept, but it's often not well understood. Next. So these are things that we look at, that in responsive feeding, there are clear expectations, you're responding, it's prompt, it's nurturant, it's developmentally appropriate, but it's not necessarily giving the child exactly what they want. So it's reading the child's cues and responding. Next. What this illustrates is just that nurturing care is powerful because it can mitigate or correct early adversities. So if we think back to the lifespan development that we showed initially, nurturing care can happen throughout life and can be a course corrector. So it's really like magic. Next. And that's what this says. It can mitigate early adversities. That's sort of the secret of nurturing care. Next. Okay, what is the impact of emergencies on nurturing care? Next. Bingo. The biggest impact is on children's security and safety. That's the biggest impact because what they knew is not there, not the same anymore. Next. Clearly, emergencies also impact their nutrition, their health, their responsive caregiving, and their early learning. So it impacts all systems within nurturing care. Next. So what are some strategies to help with security and safety? And how can we think about those within nutrition and child development? Well, I like to think of the 3 R's of security and safety, and they are relationships, routines, and resilience. So relationships can include things like consistent caregivers and responsive caregiving. Those are relationships that people who are tuned into them, who are nurturant, who are helping them throughout the day are key. Then there are routines. Children love routines. They may not tell you they do through their words, but through their behavior, they will. So consistent routines around things that matter to kids. So those are meal times, bedtimes, playtimes. Consistent routines give you predictable outcomes. So that's a critical aspect. And then resilience. What does this mean? This means so that children feel like they're making a mark. We think about adolescents wanting agency, babies want agency, 2-year-olds want agency. So resilience means opportunities for children to help and contribute and to feel positive. Next. So these are just a little example, not nearly as creative as you all could do, to practice these 3 R's: relationships, routines, and resilience, related to responsive caregiving and learning in meal times. So relationships may be, to an extent possible, engage children in choices. So could be things like having pictures that could follow meal times or accompany meal times, or having themes for meal times. A theme that one might have in a US culture this week, or really last week, would be Mother's Day. So you could have children drawing in hearts, or something that emphasizes the relationships that we have as a community, a sense of belonging. Routines are eating meals at regular time, eating with families or friend group. So it's not just eating, but it's the whole social context that goes with eating. And resilience could be, to the extent possible, engaging children in helping activities, older children helping youngers, or to some extent, children serving a bit or cleaning up. Cleaning up is easier. Just small examples. Next. So it's important to think about the workers and the caregivers and helping them tune in to these relationships and routines and resilience. How to make the daily activities as fun as possible by engaging children, because we know they're experiencing these threats of safety and security. So looking at a way to take their daily activities and help them feel part of things, help them feel engaged. Next. So this is the nurturing care framework, very much emphasizes what we're doing, what the environment is doing. So these are just 2 things. One is strengthening families, and that's helping families feel strong about nutrition. And again, if there are any places for choices, even small choices, they matter, they're helpful. And thinking about being responsive during nutrition, during play, and looking for learning opportunities so that caregivers feel like they are involved, whether the caregivers are workers or families. And then, of course, to strengthen programs and policies. Communication is critical, because when your security is threatened, you don't know what's happening. So that's important. Encouraging relationships, so building family relationships or commonality relationships, listening to family voices, and finding time for play and space. Next. This is an example of, this is from USAID, Advancing Nutrition. And so this is emphasizing some responsive feeding. There are a few changes that I might recommend in these, so just take a look and you'll see. Next. Next. Oh, in this one, the mother's in control. I'd rather have the mom looking at the child so the child can see the mother. Children imitate. So I'd rather have them looking at one another. The child is reclining. This is not a great feeding position. Child should be leaning forward. Child is opening mouth, not touching the food. Kids at this age could touch food. And so there are a few changes that we might make. Next. Next. These are just some examples of early feeding behavior. So this is from Latin America. This is from Bangladesh. Yeah, next. This is from Bangladesh. You can see mother helping child. I think this is wherever. Look at the baby imitating the mom. This is how children learn to eat. This is part of responsive caregiving. Next. This is, again, very focused on one another. Very focused. Children do what they see. Next. It involves dads and grandfathers They both have their mouths open, don't they? Next. And I thank you very much. Remember, there is no keener revelation of today's soul than the way it treats its children. Nelson Mandela. Thank you.
Wonderful. Thank you so much, Maureen. That was fantastic. I know I speak for myself, and I think for a lot of the nutrition community, it really shines a lot of light on what our part is. So really appreciate that. Now we're going to be going into the panel discussion, and I'm going to hand over to Eduardo to lead us through this. Over to you, Eduardo.
Thank you very much, Andy, and a pleasure to be with all of you. Thanks. Thank you very much, Maureen. That was an excellent presentation and beautiful pictures of practices. So right now we have the great privilege of having 3 panelists. Andy had already introduced them, all of them, and I'm going to ask them to answer a few questions to help us achieve the objectives of this webinar. And to start with, I wanted to have a question for all the 3 panelists, for Hannah, Rosemary, and Luisa. Just a little note to the participants of the webinar. Luisa will be speaking in Spanish from Colombia. So if those who don't understand Spanish, you can also check in the interpretation box there for the answer in the language of preference, French, Arabic, or English. So I want the 3 of you to tell us how your organization is working towards the holistic childhood outcomes through nutrition interventions. So we have seen that relation of achieving developmental outcomes through nutrition intervention. And I would like the 3 of you to give us an example to understand better, and for the participants to understand better how it translates in practice, the idea of child-centered programming to achieve developmental outcomes using the nutrition platforms and programs. Hannah, would you be so kind to give us the first example?
Yeah, sure. Thank you. And thank you, Dr. Maureen, for this great presentation. You made our, let's say, responses easier by explaining all the technical aspects of it. So for us, actually, we have been following the same, let's say, approach that was shared by Dr. Maureen. So in order to achieve holistic child development, we have been working on different levels. So at first, like 7 years ago, we have been implementing nutrition, like specific interventions. And we have been like working with the Ministry of Health on those nutrition specific, let's say, interventions through different models. But after that, recognizing the need for the holistic child development as shared by Dr. Maureen, we have started to expanding and building on our nutrition interventions. We have been implementing a behavior communication approach regarding nutrition, and it was a very successful one. And we have been as well working closely with the primary healthcare centers in partnership with the Ministry of Health. So we built on this and we said, okay, we are having those platforms that are working really good, so we need to integrate and build on those platforms. And for a holistic child development, we said, of course, we need to cover all the components that was shared in the previous presentation on like the need for health and nutrition, which are the nurturing care framework and the safety, the security, the responsive caregiving. And we started thinking how we can integrate those components into what we are doing. World Vision developed a model called Go Baby Go, and that model is a comprehensive model that responds to the holistic child development, where within this model you can see that there are safety, not only messages, I will talk more about it. It covers responsive caregiving, early stimulation, nutrition, and health. So we as well utilize this model in order to enhance our nutrition interventions. So for this specifically, we said that we can't achieve holistic child development unless we target, like do different level of targeting. So we said we need to work closely with the mothers, with the families, we need to work closely with the communities, and we need to work with the structures like primary healthcare centers. And of course, we need to address as well the policies, because we don't want this very important aspect not to be sustainable and not to continue and spread across most of our communities. For us, we are now working in 150 communities, vulnerable communities, specifically vulnerable. And we are as well doing different research studies in order as well to inform policies and to see and to show the evidence of how this integration is affecting the child development. So if we go to the next slide. So this is our model that we are implementing. As mentioned, this model is covering the whole domains. So we are targeting mothers when they are pregnant until the child is 2 years. As mentioned by Dr. Maureen, the first 1,000 days are the critical days for rapid growth and child development. So we as well are focusing on this period. So we identify mothers during pregnancy and start working from them before birth to make sure that we are equipping them with the skills, and we are working with them on changing their knowledge, behaviors, and provide them with the required skills. Part of this model that we are implementing, of course, covering sensitive and responsive parenting, early learning, holistic child development, play and communication. And I want here as well to focus on one point, is the daily routine, the family, what they can do with children is very critical. And we are as well trying through this model to ensure how daily routines, how interacting with children, playing with them is so critical in their and important for their holistic development. So this model is we implement it at household level, working directly with mothers to change their behaviors and to ensure that they are changing the practices, because of the many things that they believe it's good for the children. In fact, it's not. So we are following more of a behavior communication change approach. And one important aspect, since we are considered fragile context, we as well integrated psychosocial support and mental health. So at the household level, we as well work with mothers to improve their mental health and provide them with the needed psychosocial support, because if they are not feeling well, they can't care for their children. And unfortunately, like we did different like research on this topic, postnatal depression was really high among the communities that we are targeting, but working with them, incorporating mental health in what we are doing with them, really significantly improved the numbers from severe to moderate, or it was like at a later stage, they have been showing really good improvements. So mental health as well was a critical component. And when we talk about emergency, when we talked about conflict areas, safety is a critical component here. Next slide, please. This is what our model is covering. So it's an integrated package we have built on our nutrition platforms. We have like established at the primary healthcare center what we called baby-friendly clinic initiatives, where there we provide support for the clinic staff, for the mothers, not only on nutrition, but on the holistic child development as a whole. And of course, it's mental health as well, it's early child development. And we have been doing different RCTs, randomized controlled trials, to see the effectiveness of such an integrated package. The last slide, please. So this is just a quick slide that I will say here based on the evidence that we already have. ASQ is one of the tools that is used to measure child development. And you can see between the intervention and control group, as we have done several research, is that it's significantly higher among the intervention group. The intervention group are those who receive the whole package, whereas the control are those who receive the nutrition alone as a standalone intervention. And the effect size of the integrated package, the next part of the slide, is showing that integrated package, the effect size is much higher. And here it is between 0.4, 0.8 within the integrated package, whereas early child development interventions alone, the effect size is usually between 0.2 and 0.5. And here we can say that the integrated package, the outcomes on child development is much higher than just doing a standalone interventions. So this is in summary what we have been doing, and thank you all for
Shukran, Hannah. This is quite impressive. It's incredible results on this integrated intervention. Let's see now from Jambo, Rosemary. Could you give us also from the network, from the African network, your example to illustrate this integration?
Yeah, thank you very much, Eduardo. So from African Early Childhood Network, we work with the government, private sector, civil society organizations, as well as academia. And we serve as a platform to champion for excellency and collaboration in protecting children's rights, influence policy and practices, and also strengthening partnership and share experiences and knowledges related to early childhood development across the African continent. So we saw that we should take advantage of influencing the policies and practice by working with organizations across the continent. And we have worked with the African Union Commission. We saw that, yes, if we influence the policy from that angle, it will be easy to change the practices. So we worked with the African Union Commission, specifically the Department of Health, Humanitarian Affairs, and Social Development. And I'll cite just the work which we have done with this department, even though we have worked with all other departments within the African Union Commission. But in this one, we integrated the nurturing care framework in the key departmental policies. And to cite a few, the current African Regional Nutrition Strategy, it has undergone some review, and we participated. And one of the comments which came out is the issues of early childhood development were not well captured. So the review has captured it, and from next year, definitely African Union Commission will be doing another strategy, and the nurturing care aspect will be well taken care of in that strategy. And we are a member of the key task force, just to influence and increase the awareness about the agenda, because we saw that, yes, most of the discussion in health and nutrition from African Union perspective, we are not really addressing the holistic child development. So we are members of the African Task Force on Food and Nutrition Development. We are also a member of the Maternal Neonatal Child Health Task Force, and we are participating in the campaign on reduction of maternal, newborn, and adolescent mortality in Africa, which is run by African Union. It's called Kama Plus. And we, through our participation, our active engagement in these task force, as well as supporting the implementation of this campaign, we have seen that the awareness has increased significantly. And we have, good news is we have managed to work with the African Union to establish the Holistic Child Development Task Force, where all the key departments within the African Union are coming together and speaking about the holistic child development and how to integrate in their respective department. And apart from that, we have worked with the other regional economic communities. I can just cite one of the specialized regional organization, which is called the East, Central, and Southern Africa Health Community, of which we have managed to establish the expert committee from the 9 countries from the Eastern and Southern Africa. they are meeting up, and it's called the Responsive Caregiving Experts Committee. So we wanted to spell out the responsive caregiving aspect because we knew that, yes, people don't understand it well. So this one comprises of people from the RAMCA as well as nutrition experts. So this is how we have advanced the agenda from this side, from policy to practice. Thank you.
Asante, that's pretty impressive, that all the things that are happening also in the African context, and having the networks and having the African network represented here is absolutely fantastic, as there are other networks also in other regions. If I can ask Luisa also, Luisa, por favor, can you give us a little bit of your example from Colombia? Gracias.
Claro que sí, buenas tardes a todos. Es un gusto para nosotros estar acá. No voy a utilizar mi presentación aún. Quisiera compartirles desde la experiencia de Latinoamérica que nosotros nos encontramos afrontando como continente diferentes crisis, diferentes emergencias relacionadas con la migración. Pero también relacionadas con la violencia intrafamiliar, la violencia social y algunas brechas significativas en el abordaje de la equidad. Nosotros hemos encontrado que existen diferentes niveles de ayuda que podemos brindar tanto a los gobiernos como a las organizaciones que participan en nuestros países y también en el nivel operativo. Entonces, el primer ejemplo que les puedo dar es las acciones con los gobiernos. Realmente nuestros gobiernos tienen sistemas de salud que desde la acción política necesitan soporte, evidencia y recursos para la investigación. Eso porque la mayoría de los recursos que están dirigidos al desarrollo infantil no se dirigen principalmente en nuestras naciones a la investigación. Y hacer estas implementaciones sin procesos de investigación nos pone en situaciones que pueden no abordar todas las necesidades tanto de las familias como de los bebés. El segundo nivel es ese enlace que existe o que debe existir entre las diferentes organizaciones no gubernamentales, principalmente de manera conceptual. Cuando vamos a las comunidades con diferentes conceptos acerca del mismo tema, logramos confundirnos y logramos hacer intervenciones que a veces resultan en poco impacto porque todos vamos en caminos contrarios. Entonces, es muy importante la participación en los clusters y también el abordar nuestras necesidades de manera grupal. Y el tercer nivel, el más importante, es la implementación. Desde Save the Children, nosotros hemos abordado el desarrollo infantil, bueno, desde educación, pero también actualmente nosotros estamos abordando en salud el desarrollo infantil a través de la alimentación del lactante y el niño pequeño y también del programa MAMI. Y esto ha tenido diferentes niveles de impacto dependiendo del tipo de necesidades que tienen las personas. Es muy interesante para nosotros ver cómo, a pesar de que compartimos la misma situación de migración, por ejemplo, entre Colombia y Venezuela, nuestras necesidades respecto a la nutrición y al desarrollo infantil son diferentes. Mientras que en Venezuela una de las dificultades más grandes es que las mamás tienen que dejar a sus bebés tempranamente para irse a otros países a trabajar y son las abuelas y otros cuidadores quienes ayudan y soportan a estas mujeres. En Colombia tenemos problemas relacionados con las prácticas culturales y también tenemos problemas relacionados con el abordaje de la crianza. Es definitivo entender que el desarrollo ocurre incluso a pesar de la emergencia. Entonces, eso hace que necesitemos todos abordar el desarrollo como una necesidad vital de los seres vivos. Gracias.
Muchísimas gracias, Luisa. it's absolutely fantastic to see good examples of integration in 3 different continents and very different contexts. But obviously, these are good examples. But to get there, there are a lot of obstacles, right? A lot of challenges. So, Hannah, could you give us a little idea on which has been those main challenges that you have encountered in the implementing nutrition in emergencies programs to achieve developmental outcomes?
So at the beginning, when we started integrating this, it wasn't an easy idea. First, it wasn't easy to integrate it, to bring the idea to people to understand what do we mean by this. Even with our main partners, even with the health providers, it was difficult at the beginning just to let's say show the idea and why it's important and so on. So challenges at that time were not easy. But now there are opportunities, because what we did is that those challenges were turned into opportunities in order to make it a reality and make it happen. So whenever we face any challenge, we used to have a clear plan, discussion with the stakeholders on how we can address this. And some of the things as well is just informing people about the importance, as Dr. Maureen shared, for example, why it is important to do holistic child development rather than nutrition or standalone interventions. So those were some of the challenges. Of course, when we started implementing such, let's say, a program within our communities, we faced as well challenges at the household level, mothers were not convinced. They are used to different practices, different behavior. There are social norms that are affecting their behaviors. So we had to work on a behavior communication approach in order to make the required changes, because it's all focused on behavior and interaction. It's not just delivering knowledge. So it was challenges at the beginning related with mothers, with caregivers in general, mothers-in-law, of course, because some of them, they were against those changes. Fathers, sometimes they have been part of what we have been doing, and mothers-in-law. And then, of course, working with our partners, working with our communities in order to see the importance of doing such a thing. And of course, trying to find out the easiest way to do it. Build on the existing platform, not creating something from scratch. So they feel, especially the service providers, that it's a whole new thing and it's a different responsibility and they have to do additional work. And of course, due to the situation in our context and the accessibility issue in terms of physical accessibility and capacity of staff, we as well trained our community health workers, community volunteers to support with this implementation. And this is what we hope, that this is the challenge now at the Ministry of Health on how they can move forward and start implementing it, let's say, at a national level. So what we are doing now, and this is part of, let's say, the advocacy work that we will be doing, is that to show them the platform that we have been creating, the importance of engaging the communities, empower the communities to take a role, because within the situation we have, we can't, or the ministry, they can't implement within the capacity they have. So those are the few challenges that I wanted to highlight. Of course, there are other specific issues, but this is in general. Thank you.
Shukran, Hannah. Yes, no doubt there is massive amounts of challenges, and coming from Palestine, we all understand really the complexity of those challenges. But as you said, there are also ways of addressing them. And I would like to hear from Rosemary in that way of not only addressing those challenges, but the rays of hope that you see and the reasons for optimism that you can tell us about in terms of advancing that agenda of nutrition and early childhood development in emergencies. Could you give us a little bit of those rays of hope or optimism, Rosemary?
Yeah, thank you very much. Sorry, allow me not to switch on the video because I see there is a kind of instability. But yeah.
Let's hope. Let's hope.
All right. Yeah, so the two agenda, the ECD and nutrition, those are both are multi-sectoral, and it's only that when it comes to programming, people were working in silos. The two players, I should say, at programmatic level, people were working in silo, but taking advantage of, increasing understanding that nutrition and ECD are the multi-sectoral agenda. I see that we should capitalize on that one to bring the two agenda together. Sorry, can you hear me?
We can hear you fine, yes.
All right.
Bringing the two agendas together. We are with you.
Yes. All right. So there's a lot of potential just to increase the knowledge and understanding amongst the practitioners to enhance the integration at programmatic level, so that at the end of the day, we should all focus to make sure that our children being in major settings specifically meet their full potential and not operating like, okay, in silos, say that nutrition, speaking about nutrition, and ECD people talking about ECD. Let's bring the two, all the key sectors, and make sure that all the key components of nurturing care are well implemented at programmatic level. And I see an opportunity of also of strengthening the maternal, infant, and young child feeding practices, making sure that the aspect of responsive caregiving, the issues of safety and security, maternal mental health, and also the aspect of positive parenting are well taken care of, especially in emergency context. Because being in crisis or in humanitarian setting, it's easy just to focus on delivering the programs, but not strengthening the integration. But all these key aspects are very critical and need to be strengthened in when delivering the programs in humanitarian setting. And also the last one, I see that there's a potential to educate the parents and the caregivers on both ECD and nutrition, but above all, the holistic child development aspect, looking at all key components of nurturing care framework. Thank you so much.
Excellent, Rosemary. Great, especially that you mentioned, obviously, the caregivers and the parents as our partners to work with for the development of children. Luisa, if I might then go to you now. You can obviously intervene in Spanish, and just for everyone else to know that if you want to follow in other language, please go to the interpretation key. Can you tell us a little bit what support is needed? Because that's important. I mean, there is hope and there is challenges. So what support is needed to advance developmental outcomes for young children in emergencies, building upon the nutrition programs and platforms that exist? How can we leverage the global efforts to advance ECD in nutrition?
Bueno, definitivamente lo primordial es concientizar o concienciar a las personas que están abordando el desarrollo infantil desde los donantes, desde los gobiernos, en torno a la necesidad que existe de crear un nexo entre el desarrollo y las áreas humanitarias. Por ejemplo, en Colombia nosotros hicimos una investigación que estaba basada en medir las necesidades económicas para poder tener un desarrollo, para abordar el desarrollo infantil desde los gobiernos. Y esa medición revisó todas las acciones que hace el gobierno de diferentes sectores y las integró. Entonces, al hacer este link entre acciones de desarrollo y acciones humanitarias, luego podemos tomar esas acciones de desarrollo como elementos que justifican la necesidad de esta integración. Pero además de eso, nosotros debemos empezar a aprender sobre el cómo hacer esta integración. Y esta integración surge también de una ampliada a todos los integrantes de la organización. Las personas que mejores adaptaciones realizan de los programas y de los proyectos son efectivamente quienes hacen la implementación de los procesos, pero para que ellos puedan hacer esa implementación necesitan ampliar la base de lo que conocen acerca del desarrollo infantil.
Muchísimas gracias, Luisa. Thank you so much, Lisa. Hannah, can I ask you then, what has been the turning point? Because you have also to give us very positive examples. Which has been the turning point in your organization that helped to move this forward? Andy, do we have time, or because I see you?
Before we continue, we've had some confusions on amount of time, and so I just want to make sure that the interpreters are okay to stay for a bit longer. We have had the Rashid for the Arabic translation has said that he can, and I just want to confirm with Victoria and Carmelo if they're okay to stay a bit longer as we are running over time before we continue. So now they should have heard the questions. I'm sure they're going to respond. So I will let you go on with the question while we find out the answer. We may have to wrap up quite quickly.
Thank you so much. And we are also wrapping up. I think we have a lot of fantastic information and examples and good wisdom from 3 different continents and great organizations. So I'm going to go back to Hannah in terms of these turning points that we were talking about, right? I mean, we are talking about integrating systematically as a non-negotiable nutrition and developmental outcomes for children. What are those turning points in particular?
One of the most important thing that I want to say, it's like work for them to them. Like what it means that we want to work for the communities, for the benefit of the communities. But in order to achieve this, we need to work closely with them. So without working with the mothers, without working with the communities, and of course, we continue with this, let's say, framework, working with the structural levels and even policy levels. Like without this, we can't achieve the sustained, let's say, outcome that we want. So it's working closely with the community, engaging them in every and all step. It's as well doing the proper adaptation, because we might say that this is working really good, but we need to be context sensitive. We need to make sure that this is working in this context, this is not working in the other context. So we need to be agile, and we need to always think of what can work in this area and what can't, and where can we do tweaks in order to make it happen. This is very critical and important, because we can't implement it in the same way in all of our communities because of the context changes. Another thing is that having clear preparedness plans in place. For example, if we have communities that are ready, that are responsible, we work with them in the ownership that they are like, this is for them. In times of emergency, they will come and support. And in our case, we have trained a huge number of community health workers that are ready to support. For example, during Corona, most of the nurses that are working in the primary healthcare, they have been moved to the hospitals to support in hospitals, and the primary healthcare centers were empty. So at that time, the volunteers, the community health workers, they were there in order to ensure that they are still providing for the mothers and their children. So those are important points. One last thing is that it's always important to have the evidence. It's always important to track what's happening. And of course, having the, let's say, the appropriate tools in place. Like in order to make this happen, we need to have appropriate tools, not only like the physical tools we are talking about, but as well, we are talking about, for example, screening tools in order to identify delays and being able to follow up with children. This is, in summary, what were the turning points for our
great summary and great points that we have to take into consideration. Maybe now also I'm going to ask Rosemary and Luisa just like bullet points to wrap up a little bit this part of questions. Maybe you can give us which are the elements in nutrition programs, like such as stimulation, play, caregiver support. Which are those elements that should be enhanced to support early childhood development in emergencies in the beyond the most traditional aspects of nutrition in nutrition programs. Rosemary, you want to go first? Maybe just 2 points. I think we have problems with the connection with Rosemary. Luisa, do you want to answer maybe a couple of points that you think that are essential that we should take into consideration, elements in nutrition programming? Please, thank you.
Sí, es fundamental hacer énfasis en que la nutrición no es un ejercicio aislado o un ejercicio únicamente biológico. La nutrición es un proceso también emocional de construcción, y empecemos por abordar la lactancia desde la manera en que construye las emociones de ese bebé. Si las madres pueden entender los beneficios adicionales de sus acciones dentro de la nutrición, seguramente va a ser más fácil que ellas aprovechen la información que tratamos de darles, pero además que se adhieran a prácticas saludables. Las mamás que continuamente están recibiendo mensajes positivos acerca de lo muy importante que es el desarrollo infantil, y aparte de eso lo fundamental o su papel fundamental en la construcción del afecto, en la construcción del vínculo afectivo, generalmente son mamás que están más abiertas a tener experiencias perceptivas dentro de los procesos de nutrición.
Muchísimas gracias, Luisa. Thank you so much. And thank you to all the panelists for really fantastic content and examples and ideas and experience that and things that are happening all around the world. So thank you very much. Gracias, Asante Sana. And I'm going to leave the floor now to Adunia, who is going to we have time for a couple of the questions, maybe 2 questions only that are there. But as we said, this is only to awake the appetite. We are going to have other webinars, and we are going to be here, the ECD group, also to answer questions and have follow-ups on this webinar and in general for other webinars and the whole agenda on nutrition and early childhood development in emergencies. Adunia, the floor is yours. Thank you, everyone. And thanks the panel.
Thank you, Eduardo. Thank you, everyone. I think the panelists have already seen some of the questions that were raised. The first question is in terms of getting evidence that we can use to promote, this agenda for policymakers and decision makers. So, in terms of published papers and resources, if we can have some information to share. And then the second question is related to integrated programming, be it in evaluation or in the nurturing care framework list of activities, how that integration happens without burdening staff. So if we can just focus in these 2, for the rest of the questions, I think we can provide the response together with the materials from today's presentation. So Dr. Maureen and Hannah, I think the questions are between the 2 of you. Please feel free.
Thank you very much. I guess if I start with, I love the emphasis on the evidence that I think everyone talked about the importance of having some evidence to make sure that programs are working effectively, and if they're not working, what we can do to change them. The emphasis on involving the communities in that process as well is absolutely terrific. So what we need are ways to gather evidence that are not burdensome, that are valid, that don't take up too much time, but that can then be used to course correct if we need, and also can be used very much with policymakers or to increase investment in what's needed for the families during these very potentially vulnerable times that that we're in emergency situations. I can tell you I've been involved in working with the Global Scales for Early Development, or GSED, which is meant to have what's called a household form, or ways of being able to estimate children's development from a programmatic level without being too burdensome. So we will be sharing these as soon as possible. There are some that are already available. So I will stop and let others comment.
Yeah, if there's time, I can add a few things related to the evidence. Yes, it's very important, especially that this is new to everyone. And in order to influence policy, of course, we need to have the evidence, and we need to see what we can do to make it like work, and what we can change, and so on. And one of the things as well is that, as Dr. Maureen mentioned, like the appropriate tools that we use for early child development. And I want to respond to one of the questions asking about, is it a burden on staff? Honestly, what we have noticed is that when our community health workers, they are the ones who are filling this with the mothers are really so excited, and they wait for them to fill the tool to show them how their children are doing in regards of development. So what we have noticed is that mothers are really enjoying it, and so are the community health workers who are working with the mothers on it. So they feel that it's an opportunity as well to see how their children are doing, and not only just a tool that we fill and that's it. So it's more of an interactive tool. We are lucky that we have now our validated country tool that's really very friendly, very interactive, and it's really like now it's not becoming a burden anymore, because it's like what even mothers are asking for. And this is what I want to add to what Dr. Maureen mentioned. Thank you. We can't hear you.
You're unmuted, Unya.
Gracias. Tal vez podríamos devolvernos a mi primera diapositiva un momento. Quisiera explicar algo en relación con lo que ustedes han dicho.
Sanya, can you please return to the slide that's maybe 4 back? It's the first slide of Luisa's, please.
Gracias. La anterior, por favor.
Just before that one.
Yes. Bueno, el desarrollo infantil no ocurre a partir de la gestación. Ocurre cuando este ser que va a ser mamá o padre empiezan su adolescencia, cuando empiezan a desarrollar las competencias para el cuidado humano. Ahí podemos recordar que existen estrategias de abordaje, por ejemplo, la construcción del proyecto de vida, que está indicada con los adolescentes y que incluye elementos que le permiten planear su vida, no solamente para ese momento, sino para otros. Imaginémonos que el momento de tener un bebé es como hacer los primeros estudios escolares. Luego están los elementos de la salud sexual y reproductiva. Y en estos elementos de la salud sexual y reproductiva se involucran las decisiones que los seres humanos tomamos para asumir la maternidad y la paternidad. Luego están las acciones que hacemos en el contexto de la salud materna. Y esto incluye las actividades relacionadas también con su salud mental y también con su desarrollo humano. Pero recordemos que en estos 3 momentos de la vida también las personas pueden tener diferentes emergencias y podemos tener la oportunidad de educar para el momento del nacimiento. Luego tenemos unas etapas que son críticas y que la doctora Maureen ya explicó, pero en diferentes momentos nosotros como trabajadores humanitarios tenemos contacto con los recién nacidos, con los infantes y en la primera infancia, incluso en la infancia, con los padres y los cuidadores. Entonces, Tal vez no es algo muy fácil de ver, pero todo el tiempo estamos construyendo el desarrollo infantil, ¿sí? Cuando podemos hacer el contacto piel a piel y facilitamos la lactancia materna, cuando empezamos a hacer las intervenciones de alimentación del lactante y el niño pequeño, cuando continuamos la lactancia más allá de los 2 años, pero también al lado de esa lactancia, durante el proceso MAMI o durante el proceso de CMOM o durante el proceso de IYCF, hablamos de amor, cuidado y estimulación temprana. Luego, los padres tienen que hacer el abordaje de la infancia temprana, perdón. Incluso en las emergencias, nosotros podemos tener algunos momentos de contacto que no debemos desaprovechar para dar recursos a las familias y a nuestros compañeros de otros sectores acerca de la nutrición. Y de la misma manera en que nosotros podemos aprender, nosotros podemos también tener elementos como construyendo cerebros, el enfoque de construyendo cerebros, que es muy desde educación, pero que podemos integrar a nuestras acciones.
Gracias, Luisa. Vamos a compartir también esta diapositiva y la intervención y seguiremos. Andy, can I give you the floor also to wrap up and thank our panelists and,
Yes,
and
super.
participants?
Thank you. Thank you to everyone. Sanya, would you be able to get back to the following slide? We are a little bit, go back one, please. We're a bit short in time because we actually, our wonderful translators, Carmelo and Rashid and Victoria, we want to thank you from the bottom of our hearts. They actually were only scheduled until the top of the hour, and we are now 17 minutes later. So 1 minute more. And so this one, if you want more information on the nutrition and ECD and emergencies group, we have a poster that we put out. Colleen is going to be popping in the chat box right now the links for this poster and you in different languages so that you can read it in whichever you prefer. Please do reach out if you have any questions. And can we go on to the next slide, please? If you're looking for supports for nutrition and emergencies or on other aspects that are complementary and that need to be part and parcel of everything that we do in nutrition, you can reach us on the website, the Global Nutrition Cluster website, through this request support button and filling in a 2-minute form. And if somebody can put in the chat box the Nutrition Cluster website, that would be great. And if we can go on to the next slide, please. So I want to thank everyone for your participation. Don't jump off yet. There is, so I want to thank all of our wonderful presenters and panelists. So Dr. Maureen Black, Luisa Vargas, Hannah Rabadi, and Rosemary Mwaisaka. We were blessed to have you with us today, and we really appreciate your interventions. For all of those participants who asked questions and they haven't been answered, we will put out through a document. We'll have a written responses to those questions to share with the recordings and to put onto the website to complement. And I apologize that we don't have time now to do that. Really, we want to thank you for your participation. And now on to the next slide, please. When you jump off, you will see an evaluation pop up. There's a couple of special questions in there. Please do take time to look at that. It won't take you very long at all. And it really will help to make sure that we gear whatever comes next to what you are asking us for. So I thank you so much. And I hope you enjoyed the rest of your day. We've had I think, a wonderful, fruitful session today, and we're looking forward to the next ones. Thank you.
Thank you. Shukran, Axante. Gracias.
Thank you.
Muchas gracias.
Merci.